Welcome back to another exciting lecture of human development. In this lecture, we'll explore the intricate journey of human development before birth, social determinants of prenatal development, and recommendations to improve maternal health during the prenatal period. Prenatal development begins at conception, a moment that marks the union of sperm and ovum. Women can conceive only during a brief window in their 28-day cycle, while men produce millions of sperm daily. These sperm are guided by the heat emitted from the ovum. When one successfully penetrates the egg, a zygote is formed, containing 46 chromosomes, half from each parent. This single cell marks the beginning of a new life. The first stage of prenatal development is the germinal period, spanning from conception to 2 weeks. During this time, the zygote begins rapid cell division as it travels down the fallopian tube towards the uterus. By 72 hours, cells begin to differentiate. A blastocyst forms, a fluid-filled sphere with a protective outer layer and an inner cluster of cells that will become the embryo. Around day 6, the blastocyst begins implantation into the uterine wall, completing this process by day 11. Next is the embryonic period, from weeks 3 to 8. The implanted blastocyst is now called an embryo. Support structures begin to form, including the amnion, which holds amniotic fluid, and the placenta, which facilitates nutrient and waste exchange between mother and embryo. Around day 22, the neural tube begins to form, eventually developing into the central nervous system. By the 7th week, webbed fingers and toes appear, and by the end of this period, all basic organs and body parts are present, though not yet fully formed. The final stage is the fetal period, beginning at week 9 and continuing until birth. The organism, now called a fetus, undergoes rapid growth and increasing complexity. By the 14th week, limb movements become coordinated. The fetus is covered in lanugo, a fine hair, and protected by vernix caseosa, a greasy substance. The last 3 months are marked by substantial growth. Around 22 weeks, the fetus reaches the age of viability, the point at which survival outside the womb becomes possible with medical support. Environmental factors can significantly shape prenatal development, particularly through exposure to teratogens, agents that can cause harm to the developing fetus. The impact of teratogens depends on several principles. First, there are critical periods during which the embryo is especially vulnerable, particularly in the embryonic stage. Second, the dose matters. Higher doses and longer exposure typically result in more severe effects. Third, individual differences, such as genetic makeup and maternal health, influence how teratogens affect development. Finally, teratogens can have complicated effects, sometimes causing a range of birth defects or sleeper effects, problems that don't appear until later in life. Teratogens come in many forms. Over 90% of pregnant women take over-the-counter medications, yet some, like isotretinoin, are linked to severe abnormalities and miscarriage. Even common substances like caffeine have unclear effects. Alcohol is a well-known teratogen and the leading cause of developmental disabilities. Fetal alcohol spectrum disorders, FASD, encompass a range of effects, with fetal alcohol syndrome, FAS, being the most severe. Cigarette smoking and e-cigarette use are also harmful, increasing the risk of fetal death and complications. Marijuana use during pregnancy is less studied, but early findings suggest it may contribute to developmental delays. Other substances, such as cocaine and opioids, pose serious risks. Cocaine exposure can impair motor skills and reduce brain volume, while opioids are linked to poor developmental outcomes. Maternal illnesses like rubella and HIV can also be devastating effects. HIV, in particular, can be transmitted during birth, and access to treatment varies widely, especially in developing countries and among marginalized populations. Environmental hazards, including exposure to chemicals, pollution, and radiation, can also disrupt development, sometimes causing genetic mutations. Understanding teratogens requires an intersectional perspective. Many infants are exposed to multiple risk factors simultaneously. In some states, maternal substance use is legally considered fetal abuse, and criminalizing these behaviors disproportionately affects women of color and those in poverty. These policies can discourage women from seeking prenatal care. Moreover, poverty, inconsistent parenting, and chronic stress often interact with teratogen exposure, compounding the risks to the developing fetus. Maternal nutrition plays an important role in healthy development. The quality of a parent's diet can affect the health of the sperm and egg, and poor nutrition during pregnancy may cause growth problems before and after birth. In some cases, malnutrition increases the risk of neural tube defects. For example, spina bifida occurs when the lower part of the neural tube does not close, causing spinal nerves to develop outside the vertebrae, which often leads to paralysis. Another condition, anencephaly, happens when the upper part of the neural tube fails to close, preventing the brain from developing properly and usually resulting in death shortly after birth. A mother's emotional well-being during pregnancy greatly influences prenatal development. Chronic stress can increase risks for the fetus, as stress hormones raise the baby's heart rate and activity levels. Research shows that maternal anxiety during pregnancy is linked to emotional difficulties in children throughout infancy, childhood, and adolescence. Additionally, broader contextual factors such as poverty and racism can intensify how children respond to stress, further shaping their development. Maternal age is an important factor in pregnancy outcomes. While more women are choosing to have children later in life, this can increase certain risks for the newborn. However, it is important to note that most women over the age of 35 still give birth to healthy children. Paternal characteristics also play a role in child development. Fathers strongly influence the home environment, and advanced paternal age has been linked to a higher risk of birth defects. In addition, both fathers and mothers pass on epigenetic markers that can affect the long-term health of their children. Despite the importance of early prenatal care, many women face significant barriers to accessing it. In fact, about 25% of women in the United States do not receive prenatal care until after the first trimester. One of the most common obstacles is a lack of health insurance, which can delay or prevent women from seeking the medical attention they need during this critical time. Access to prenatal care is also shaped by race, ethnicity, and socioeconomic status. Prenatal care is closely linked with education. For example, women with higher levels of education are more likely to receive timely and consistent care. Unfortunately, low socioeconomic status is strongly linked to poor birth outcomes. However, cultural strengths can offer protection. For example, protective cultural factors and strong social support systems, as seen in Latina women, often contribute to positive birth outcomes. Yet these protective effects tend to diminish as Latina women acculturate to American society. This highlights the importance of considering intersectionality, how overlapping identities and social factors influence access to care and health outcomes. Given the importance of maternal health, there are recommendations to promote women's health and support prenatal development. It is strongly encouraged to practice healthy behaviors before and during pregnancy. This includes regular exercise, eating nutritious foods, and getting enough sleep. Preventative care such as immunizations and dental checkups are important as oral health issues like gingivitis and cavities can worsen during pregnancy. Women should avoid tobacco, marijuana, and other harmful substances. Since no amount of alcohol is considered safe during pregnancy or while trying to conceive, women should stop alcohol use when planning to become pregnant. Those with chronic conditions like diabetes or hypertension should follow medical advice carefully. A daily folic acid supplement is essential for reducing the risk of neural tube defects. Women who are older or have chronic conditions can reduce risks by maintaining preventative and appropriate prenatal care. Fathers and partners play an important role in supporting the health of mothers and infants. Men should be positively engaged in decision-making to support maternal health while respecting women's autonomy. Women should attend all healthcare appointments, including primary care, prenatal, postpartum, and any recommended specialty care. They should provide a complete medical history, including prior pregnancies and complications. It's also important to know and track health indicators such as blood pressure, weight, and blood sugar, if diabetic, both during visits and between appointments when recommended. Finally, women should feel empowered to communicate openly with healthcare professionals about any health concerns, including symptoms, past health issues, or sensitive topics such as substance use or intimate partner violence. If concerns are dismissed, they should persist or seek a second opinion. Patients can use resources like the Joint Commission's Speak Up campaign to become more active in their care. It is also essential to learn the warning signs of pregnancy complications that require urgent medical attention. Campaigns such as the CDC's Hear Her initiative provide education and encourage women and their support systems to raise concerns with providers.